A norovirus outbreak has struck more than 70 people aboard a Royal Caribbean cruise ship en route from San Diego to Miami. The vessel, named Serenade of the Seas, departed on September 19 for a 13-day journey and is scheduled to dock in Miami this Thursday. According to a report from the Centers for Disease Control and Prevention, 71 out of the ship's 1,874 passengers and one crew member out of 883 have reported symptoms of illness during the voyage. The main symptoms include diarrhea and vomiting, hallmarks of norovirus, a highly contagious gastrointestinal illness known to spread quickly, especially in closed environments like cruise ships. The CDC was alerted to the outbreak through its vessel sanitation program, which is tasked with monitoring and responding to public health threats aboard international cruise vessels. In response to the reported illnesses, the crew aboard Serenade of the Seas has implemented heightened cleaning and disinfection protocols. They've also started collecting stool samples from affected passengers to confirm the cause of the outbreak and have isolated those experiencing symptoms to help prevent further spread. Royal Caribbean released a statement emphasizing that the health and safety of their guests, crew, and the communities they visit remain their top priority. The company says it is continuing to follow, and in many cases exceed, the standard public health protocols required on cruise ships. This includes enhanced cleaning procedures, isolation of ill individuals, and routine sanitation of high-contact surfaces. Norovirus is one of the most common causes of gastrointestinal illness worldwide. It spreads through contaminated food or water, touching infected surfaces, or close contact with someone who is infected, such as sharing utensils or meals. Symptoms usually appear 12 to 48 hours after exposure and can include nausea, vomiting, diarrhea, and stomach cramps. While it generally resolves on its own within a few days, the virus is highly contagious and can be particularly disruptive in environments like cruise ships, where thousands of people live and dine in close quarters. This latest outbreak is part of a larger trend in 2025, with the CDC reporting a total of 19 gastrointestinal illness outbreaks on cruise ships so far this year. Of those, 14 have been confirmed as norovirus-related. Health experts note that the virus is difficult to contain once it begins spreading on board, which is why prompt response and strict sanitation measures are so critical. The CDC continues to monitor the situation and will work with Royal Caribbean to ensure all necessary health precautions are taken before passengers disembark in Miami. While cruise lines have worked to improve sanitation and public health protocols over the years, norovirus remains a recurring challenge for the industry. Experts remind travelers to wash their hands frequently, avoid sharing food or drinks, and report any symptoms early to help reduce transmission. Passengers aboard Serenade of the Seas are being advised to remain alert for symptoms and follow crew instructions regarding hygiene and isolation if they feel unwell. As the ship approaches its final destination, both the CDC and Royal Caribbean are expected to continue investigating the source and impact of the outbreak. In the meantime, passengers and crew alike are hoping for a safe and healthy conclusion to what was meant to be a relaxing voyage across the sea.